So I will be demonstrating how to check for the range of motion in the knee joint, namely flexion, extension, and rotation. So why is checking for your ROM important? So this will help me see the available range of motion in the knee joint, and aside from that, it will also help me see if there are any limitations in the motion. So checking for the ROM will help me know the quality of the joints of the patient, and the results will help me create a unique plan of care in order to treat the patient in the future.
Start with the patient in supine with their knee in extension. Align the proximal arm with the lateral midline of the femur using the greater trochanter for reference. Align the distal arm using the lateral malleolus for reference. The fulcrum should be aligned to the lateral epicondyle of the femur. Instruct the patient to bring their foot towards their butt by bending their knee. The hip should be approximately in 90 degrees of hip flexion. And the range occurs when resistance is felt. The resistance should feel soft due to muscle. The normal range of motion of knee flexion is 0 to 135 degrees. Knee extension is usually recorded as the starting position for flexion, but since we started with flexion, we will record extension as a return to the 0 starting position from the end of knee flexion ROM. Align the proximal arm with the lateral midline of the femur using the greater trochanter for reference. Align the distal arm using the lateral malleolus for reference. The fulcrum should be aligned to the lateral epicondyle of the femur. The resistance should be firm because of the tension in the joint capsule and associated ligaments. The normal range for knee extension should be 135 degrees to 0 degrees. External rotation of up to 20 degrees and internal rotation of up to 10 degrees should be achievable. Pay attention to pain or mechanical resistance, which can be seen in meniscal tears or if a torn meniscus is trapped.